Everybody, I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And we are in our stress relief boot camp. Congratulations to you for sharing this, for learning, for finding this to be a safe space. I'm going to modify how we're doing the videos, what I'm teaching, the information that you are receiving. I've seen a few colleagues do really quick, concise, to the point information, and unfortunately that's not how my brain works, but I'm working on it, so we are all a work in progress here. I have some notes tonight. Let me know if you're tuning in live. Give me a hello, give me a thumbs up. If you're watching the replay, let me know when, let me know replay. And share this with someone that you think would be benefiting of it. Tonight's topic, the 5 things that your physician does not want you to know. I'm spilling some insider secrets, but still, share the video. If you have any experiences with this topic, feel free to comment as well. If you have questions that come up because of this, as always, please comment below. Or if it's something that you would like to discuss privately, of course, send me a private message and I'm happy to poll the group anonymously. So let's jump right in. So, of the 5 things your physician does not want you to know, you know your body better than they do. Yes, no matter what the specialty, we undergo a considerable amount of education. However, that is all in theory. Every single person is different. Every single body is different. The human body is a complex combination, and when you add in chronic disease, you add in medication, whether that is a pharmaceutical intervention or a supplement, it's essentially a chemistry project. And there's absolutely no way to have your pulse on absolutely everything that is going on. So you, as the patient, it is up to you to make sure that you are not only communicating effectively, but that you are trusting the individual that you're working with. And recognize that the recommendations that they're giving you, again, are based on a theoretical model and not necessarily you today, right now. So make sure that you are communicating clearly with what's going on with you to them. Do not feel intimidated, feel confident, feel strong, and be your own advocate. Number 2, physicians keep an extremely tight schedule. They're allowed, depending on the specialty, 6 to 8 minutes per patient. So if you have the expectation that you're going to go in and converse for a little bit, catch up on what's happened since you were seen, and that could have been a year prior, that could have been more, you're going to review test results, you're going to allow the physician in that 6 to 8 minutes time for their brain to forget the patients that they saw previously and focus solely on you and what you're going on and problem solve in that time, that is a huge expectation. So cut your doctors a little bit of slack, but at the same time, recognize that, again, you need to be very clear and concise. Maybe write notes before you go in. Bring a pad of paper, bring a pen with, so that you can write down the suggestions that they make. Again, this is a very tight schedule, very tight time frame, and they have patients after you. So if they start running behind, their mind may not necessarily be on your case and your problems, and it may start to filter over to who they need to see next. Number 3, the 3rd thing that your physician does not want you to know. This is a high pet peeve of mine, being a functional medicine physician. The word idiopathic. Now, anybody feel free to chime in if you know what that word means. Now, in medical terminology, idiopathic means no known cause. So in the 6 to 8 minutes that your physician has with you, if they cannot determine what is going on or if testing has been done and there's not a clear-cut answer as to what your symptoms are based on, you will most likely get the diagnosis of idiopathic XYZ. And my feeling as a functional medicine physician is that it is your doctor's job to determine why you have whatever symptomatology, again, that it is. So if you are not getting the right answer, if you hear the term idiopathic, if you've been diagnosed with something that is allegedly idiopathic, you need to do your own research. You need to continue to ask questions, continue to dig deeper. From a functional medicine standpoint, that's exactly what we do. It's called swimming upstream. So we take a look at what your not only symptomatology is, but stressors that are impacting your diagnosis, mediators, things that are perpetuating the problem, and antecedents, things that set the groundwork for where you are right now. And Vanessa, you know that term. Yeah, unfortunately, a lot of people know that term. And from a functional medicine standpoint, it's a BS term. It's your doctor's job. If anybody watched the show House, literally that's what medicine should be. They should be detectives. They should be determining exactly what's causing the problem. Idiopathic is nonsense, in my personal feeling. Number 4, the 4th thing that your doctor does not want you to know, they make recommendations based on your labs, very clear cut, where they would like you to be. And if you don't fall in XYZ parameters, they give you a diagnosis and they give you medication. From a functional medicine standpoint, we are taught to treat the person and not just the labs. So you need to take those two things together and take a look at what's going on. I've done a few previous videos on lab work, on the thyroid, and the number one thing that I hear from women is, I wasn't feeling great, but my doctor said my labs were okay, or my labs are within normal range, and my doctor says it's in my head, or I don't need anything because my labs are okay. And I will tell you again that it is your job to be your own advocate, do your own research, and if you don't feel good, if you don't feel as good as you want to, you need to ask for help. And you may not like the answer. The answer may be you need to put the wine glass down. The answer may be you need to go for a jog. The answer may be you need to eat some more broccoli. But at least you're getting an answer. And if you do not feel good, despite what your labs look like, because majority of the time, those levels that your allopathic physician is using, it's going to take a while until you fall off the curve. And when you fall off the curve and you are diagnosed with a disease, it will be that much harder for you to crawl back out. So again, as soon as you don't feel great, as soon as you don't feel the way that you want to, request help. Look for some assistance. And then the 5th thing that your doctor, your primary care doctor, does not want you to know, they work for you. So if you are not happy with the answers that you're getting, if you don't like their bedside manner, if you don't like the way they talk to you, if they are running behind, stop complaining. Hire slow and fire fast, okay? Those are words I live by at my office when it has to do with patients and when it has to do with staff. And that's what I want you to live by when it comes to medical decisions that are made for you. There's almost no one more important in your life, aside from family, than the relationship that you have with your physician, or the relationship that you should have with your physician. And it should be someone that you trust, someone that you respect, and someone that you enjoy maybe seeing. So if that's not how you feel when you see your doctor, you absolutely need to talk to someone. Katie, what are you saying? Number 4, this has been my favorite thing about seeing you and this mindset, working at figuring out until you feel your best. Not just good enough for that normal range. Yeah, that's awesome. Thank you, Katie. That is good. That is fabulous advice. So remember, your doctor works for you. If things are not going well, and they're human, okay? Believe you me, I'm sure that I have had patients, I can think of 2 actually. One that started seeing Jade, liked The Office. I saw him. I was probably not having the best day. We were discussing having a disc herniation. And anyone that knows me either personally or professionally, I have issues communicating. I'm great on camera. I can lecture to 5,000 people and I'm amazing and everybody wants to be my best friend. One-on-one, I'm very direct. And although I'm probably the most empathetic person in the room, I can come across as being too direct, being too to the point. And so I remember telling this patient that after he was talking about his disc herniation and he would never again be able to lift his kids and he would never again be able to do some of the activities that he wanted to do. And I have disc herniations myself, and I had since gained 35 pounds, let's say, being pregnant. I had delivered a baby with no drugs, no interventions. I had recovered. I had worked out that whole time, and I continued to work out, and I lifted weights. I was going to be in a bodybuilding competition. And I remember sort of saying this to him, a little bit nicer than I just delivered right now. But I remember saying this to him, and I could tell by the look on his face that he felt that I was belittling his pain. And he never came back to the office again. And I'm sure that he thinks that I'm a jerk and I didn't care, but I was trying to motivate him and show him what he was capable of. I also had a patient who flat out said to me, like, are you having a bad day because you're being kind of short? So that's it. So what you should do under the circumstances when you are remembering that your physicians work for you, they are human, they are people, they will have bad days, but if you consistently are feeling like you're not getting the answers that you want, you're not being treated the way that you want, your concerns are not respected, then please absolutely ask, number one, and if their response or their dialogue with you is not up to your standards, then please find a new physician. So that's my quick and dirty 5 things that your doctor does not want you to know. If there's questions, again, follow up with me privately or post in the comments below. We are going to be doing some more of these quick and dirty videos because I think that they are working well for the time that all of us have. So if there's a specific topic you want to know about, send me a message. If there's something that you'd like to discuss amongst yourselves, please share. This group is absolutely for you guys. It is a safe space. And because we hit 500 people, we're going to do a giveaway. I'm not going to do it tomorrow because it's Mother's Day, so I'm going to give you all a little bit of a reprieve. But stay tuned Monday because there's super cool stuff, a million ways to enter. And I hope that we're able to share the health together. So have a fabulous weekend. It's a little chilly here in Chicago, but the sun was out and we had a nice day. I hope that you did too. So have a great night. Sweet dreams. I love you all. Ciao.